America's seniors are facing a devastating financial blow disguised as good news, as the 2026 Social Security cost of living adjustment that promised relief from rising prices is being systematically eroded by record-breaking Medicare premium increases that will leave millions of retirees worse off than before. This represents the most significant assault on senior purchasing power in recent memory, affecting over 75 million Americans who depend on these programs for their basic survival. The numbers tell a story of bureaucratic betrayal that should outrage every American approaching or enjoying retirement. While the Social Security Administration proudly announced a 2.8% cost of living adjustment for 2026, translating to an average monthly increase of just $56 for retirees, the Centers for Medicare and Medicaid Services quietly imposed a crushing 9.7% increase in Medicare Part B premiums, jumping from $185 to $202.90 per month. This $17.90 monthly premium hike represents the second largest Medicare increase in the program's history, exceeded only by the catastrophic $21.60 increase in 2022. For seniors who budget every dollar, this premium explosion wipes out nearly one-third of their entire Social Security raise before they even see it, leaving them with barely $38 in additional monthly income to combat inflation that continues to ravage grocery stores, gas stations, and pharmacies across America. The arithmetic is stark and unforgiving. The typical retiree receiving the average Social Security benefit of $2,071 will find their net increase reduced to approximately $38 per month after Medicare premiums are deducted. That's less than $1.25 per day, not even enough to buy a cup of coffee in most American cities. To help cope with inflation that has driven up the cost of everything from prescription medications to heating bills. This represents the third consecutive year that Medicare premium increases have outpaced Social Security cost of living adjustments, creating a compounding crisis for senior financial security. The 2026 Medicare increase of 9.7% is more than 3 times the Social Security COLA of 2.8%, continuing a devastating pattern that saw 2025's Medicare premium increase of 5.8%, more than double that year's Social Security COLA of 2.5%. Mary Johnson, an independent Social Security and Medicare policy analyst and advocate for seniors, has documented this alarming trend with precision that should terrify anyone planning for retirement. Her research reveals that Medicare premium increases have been systematically outpacing Social Security adjustments, creating what amounts to a stealth benefit cut that Congress refuses to address directly. The Senior Citizens League, a nonpartisan organization advocating for older Americans, has been sounding the alarm about this crisis with increasing urgency. Their policy analyst, Shannon Benton, warns that, especially since the pandemic, rising Part B premiums have been ruining seniors' finances. The data shows that many older Americans already enjoy a lower standard of living than younger citizens, making a fulfilling retirement feel like a dream that's further and further away. The human impact of these numbers extends far beyond spreadsheets and policy papers to kitchen tables across America, where seniors are making impossible choices between medications and meals, heating and health care. For the 8% of Medicare beneficiaries with higher incomes who pay elevated premiums based on their modified adjusted gross income, the financial punishment is even more severe, with total monthly Part B premiums ranging from $284.10 to $689.90. The timing of this financial assault could not be worse for America's rapidly aging population. More than 10,000 Americans turn 65 every single day, joining the ranks of Medicare beneficiaries just as the program becomes increasingly expensive and less generous. These new retirees, many of whom spent decades planning for their golden years, are discovering that the safety net they counted on has gaping holes. The Medicare Part B deductible is also increasing for 2026, climbing from $250 to $283 annually, another $26 burden that seniors must shoulder before their coverage even begins. This means that retirees will pay more in premiums and more out of pocket before receiving any benefits, creating a double financial burden at precisely the time when fixed incomes are most vulnerable to economic pressures. However, there is a silver lining buried in the complex landscape of senior benefits that many Americans may not know about. A new federal tax deduction specifically for Americans aged 65 and older takes effect for the 2025 tax year, potentially providing up to $6,000 in additional deductions for qualifying seniors. This benefit, part of Trump's One Big Beautiful Bill tax legislation, could significantly reduce or even eliminate federal income taxes on Social Security benefits for millions of older Americans. The eligibility requirements for this senior tax bonus are straightforward and generous. Individual filers with modified adjusted gross income up to $75,000 and married couples filing jointly with combined income up to $150,000 can claim the full $6,000 deduction. The deduction phases out at higher income levels but still provides substantial savings for middle-class retirees who have been squeezed by inflation and rising healthcare costs. Andrew Herzog, a certified financial planner and enrolled agent at the Watchman Group in Texas, explains that while this won't provide dollar-for-dollar savings like a tax credit, it can substantially reduce the tax burden on Social Security benefits. For many seniors, this could mean keeping hundreds or even thousands of dollars that would otherwise go to federal taxes, providing genuine relief from the financial pressures created by rising Medicare costs. The prescription drug landscape offers another ray of hope for seniors struggling with healthcare costs. Starting January 1, 2026, out-of-pocket costs for the first 10 Medicare negotiated prescription drugs will fall by an average of more than 50% for people in standalone Part D plans. These medications, used by nearly 9 million Medicare seniors, treat critical conditions including diabetes, heart disease, autoimmune disorders, and cancer. This dramatic reduction in prescription drug costs represents one of the most significant victories for senior advocacy in years, directly addressing one of the primary financial concerns that keep older Americans awake at night. The ability to afford life-saving medications without choosing between pills and groceries could transform the quality of life for millions of seniors who have been rationing medications or skipping doses due to cost concerns. The Social Security wage base is also increasing for 2026, with workers paying Social Security taxes on earnings up to $184,500, compared to $176,100 in 2025. While this doesn't directly affect current retirees, it demonstrates the program's ongoing adjustments to reflect changing economic conditions and ensures that higher earners contribute proportionally to the system that will support future generations of retirees. For seniors still working, and an increasing number are choosing or being forced to continue employment past traditional retirement age, the earnings limits are also changing. Workers younger than full retirement age can earn up to $24,480 in 2026 without affecting their Social Security benefits, while those reaching full retirement age during 2026 can earn up to $65,160 before benefits are reduced. The full retirement age itself continues its gradual increase, reaching 66 years and 10 months for those born in 1959. This ongoing adjustment reflects increased life expectancy, but also means that younger seniors must wait longer to receive full Social Security benefits, adding financial pressure during what should be their golden years. One concerning development that may directly affect seniors' ability to access help and information is the Social Security Administration's plan to significantly reduce in-person services at field offices. According to internal documents, the agency aims to cut in-person visits by half during fiscal year 2026, from more than 31 million to just 15 million visits. This reduction in face-to-face customer service comes at a time when the senior population is rapidly expanding and many older Americans struggle with online services or complex telephone menu systems. Field offices provide crucial in-person support for applying for benefits, replacing Social Security cards, and resolving complex issues that cannot be easily handled through automated systems. The broader context of these changes reveals deeper structural challenges facing America's senior support systems. Both Social Security and Medicare face long-term funding crises that could devastate benefits for future retirees. The Medicare Hospital Insurance Trust Fund could be depleted by 2033, potentially triggering automatic payment reductions to hospitals and healthcare providers. The Social Security Retirement Trust Fund faces a similar deadline, with potential benefit cuts of approximately 19% if Congress fails to take corrective action. These looming financial cliffs create uncertainty for current retirees and terror for younger Americans trying to plan for their own retirement years. The failure of political leaders to address these challenges proactively means that seniors are caught in an increasingly expensive and unreliable system that promises security but delivers anxiety. The Medicare Advantage landscape is also becoming more challenging for seniors in 2026 as insurers scale back benefits, raise costs, and reduce provider networks. Many retirees who chose Medicare Advantage plans for their additional benefits are discovering that their doctors are no longer covered or that their out-of-pocket costs have increased substantially. The annual open enrollment period becomes a minefield of confusing choices and potential financial traps for seniors trying to navigate complex insurance options. For retirees living on fixed incomes, the compounding effect of these changes creates a perfect storm of financial pressure. Rising Medicare premiums, increasing deductibles, reduced benefits, and minimal Social Security adjustments combine to steadily erode purchasing power and force difficult lifestyle adjustments. The promise of a secure retirement supported by earned benefits becomes a daily struggle to make ends meet. The geographic impact of these changes varies significantly across the country, with seniors in high-cost areas facing particularly severe challenges. A $56 monthly Social Security increase that might provide modest relief in rural areas becomes meaningless in cities where housing costs, utilities, and basic necessities consume the entire adjustment and more. The psychological impact on seniors cannot be understated. Many retirees who worked their entire lives and saved responsibly find themselves questioning fundamental assumptions about retirement security and American promises to those who contributed to the system for decades. The stress of financial uncertainty compounds health problems and reduces quality of life precisely when Americans should be enjoying the fruits of their lifetime of labor. Looking ahead, the trends that are squeezing seniors show no signs of improvement without significant policy intervention. Healthcare costs continue to rise faster than general inflation, Medicare funding pressures intensify, and the political system remains gridlocked on solutions that would require difficult choices and compromise. Seniors find themselves caught in the middle of these larger policy failures, paying the price for political inaction. The message for Americans approaching retirement is clear. The traditional assumptions about Social Security and Medicare providing reliable, predictable support may no longer hold true. The programs that previous generations could count on are becoming increasingly expensive and less generous, requiring more proactive financial planning and lower expectations for government-supported retirement security. For current retirees, the immediate priority is maximizing every available benefit and taking advantage of programs like the new senior tax deduction that can provide genuine relief. Understanding Medicare options, prescription drug benefits, and Social Security optimization strategies becomes essential for preserving purchasing power and maintaining dignity in retirement years. The crisis facing America's seniors represents more than numbers on government spreadsheets. It reflects a fundamental breach of the social contract that promised security in exchange for a lifetime of contribution and responsibility. The resolution of this crisis will determine whether America honors its commitments to those who built the nation or abandons them to financial uncertainty in their most vulnerable years.